Oke, Assalamualaikum warahmatullahi wabarakatuh. Tonight, in this opportunity, we will be debating to fulfill our English debate midterm assignment with the topic the use of mask during COVID-19 pandemic. Let me introduce myself first. I am Mirwan Maulana Rahman as the pro team, and my partner is Putri Ahadiatul as the contra team. So let's start right. First, let me give my opening statement. As we know, one of the health protocols that must be done when doing activities during a pandemic is wearing a mask. This is important to prevent transmission of the coronavirus. According to Dr. Rizal Fadli from Halodoc, masks need to be used correctly in order to protect ourselves and also other people from the spread of the coronavirus that can occur through the air. Also, wearing a mask can prevent the spread of asymptomatic coronavirus. According to the U.S. Centers for Disease Control and Prevention, aka CDC, an estimated 50% of transmission occurs before people developing symptoms of COVID-19. Makes it very difficult to detect who is potentially transmitting the virus. Therefore, wearing a mask is an easy way to reduce the risk of spreading the infection unnoticed. I think that's it for my opening statement. And Putri, please express your opening statement.
Okay, thank you, Mirwan. From my perspective, Max is not the one part of strategy to suppress transmission and save our life during the pandemic COVID-19. But the use of Max is just not to provide level protection to against COVID-19. The pandemic period has required every nation to enforce health protocols, including Indonesia. However, this application of health protocols, especially face mask, is in developing and densely populated countries often cause another problem. After more than 2 years wearing surgical masks due to the COVID-19 pandemic, use mask has become significant risk and ecosystem. As they are producing waste in high amounts, there are potential sources and disturbance by themselves and microplastic contamination in water system. According to data shared by Center for Disease Control and Prevention, since the beginning of the pandemic, disposable face mask has become a part of everyday life as we know. It's estimated that 100 billion face masks are used globally every month. I think that's it.
All right, Putri, thank you for your opening statement. And I see what you are getting at, but now medical waste is regulated in Law number 18 of 2008 on waste management. Based on the circular letter of the Minister of Environment number 2 of 2020, infectious waste is transported and destroyed in B3 waste treatment. In general, handling medical waste needs to use the concept of 2P and 2S. 2P to S is process, sort or pilah, store or simpan, and distribute or salur. So here's the 2P2S concept that you can do. First is process. Soak the mask using warm water, then cut the mask using scissors. And number two, sort. Put the mask in an old bottle or a box. Number three, store. Spray the inside of the bottle every time you put in a disposable mask, then store and close it tightly. And number four, distribute. send it to a healthcare facility like a community health center, puskesmas, or one of the companies that have medical waste treatment technology. I think that's it for me. Putri, please.
Okay, these totally insectable, most of them are disposable masks made from plastic microfiber. And even the pandemic slowdown in some parts of world, healthy care workers are expected to continue wearing masks most of the time. Disposable masks are a are a plastic products and cannot be biodegraded into the smaller plastic particles. Laksana Handoko, head of the National Research and Innovation Agency, during a meeting respective commission, he said that disposable masks bring a negative impact for the final disposal site or TPA in this country. He mentioned the waste from disposable face mask is categorized as dangerous or B3 waste that were directly dumped into the landfill. In addition, research and finding has shown the virus has potential to survive in plastic surgical marks for almost 7 days. Some animals are also unable to differentiate between the trash, food, and up ingesting the max. This innocent animal could choke on them and die. Smaller animal may be entangled into the elastic within the mask, and the plastic itself can bring down into the small particle like nano and microplastic and accumulate in the food chain, thereby threatening the entire ecosystem. I think enough.
All right, thank you, Putri. And let me give my closing statement. So, in conclusion, is the use of mask during activities during the pandemic can prevent the spread of the coronavirus, which can spread through the air, as I mentioned before. While for the problem of medical waste that occurs due to the large number of disposable masks, it has been regulated in Law number 18 of 2008 on waste management. And we can also manage the medical waste that we have by means of 2P2S or process, sort, self, distribute, as I mentioned before. Um, that's it. I think that's it from me. And Putri, please feel free to give your closing statement.
Okay, for my closing argument, however, while we need to protect ourselves against the pandemic COVID-19, we need to do it in a way that doesn't intake any harms to our terrestrial and aquatic environments and the future of our own kind. When COVID-19 spreading in our community, we can save by taking some another simple protection, such as physical distancing, keeping room well ventilated, avoiding crowds and cleaning your hands and coaching into the bend or elbow or tissue. WHO respective to Indonesia that using masks can give false sense of protection for healthy people. Dr. Perataran says if you do not wear the mask properly and touch the mask with unwashed hand or remove it incorrectly, you can actually place yourself at greater risk and transmitting germs and make yourself and others sick. I think there are two key points that everyone must know about who needs a mask. First, if you are healthy, you don't need to wear the mask unless you are taking care for person with suspected COVID-19 infection. And the last, wear a mask if you're coughing or sneezing. I think this my closing argument. Thank you.
Okay, thank you, Putri, for your closing argument. I think that's not enough for us tonight. And thank you. Assalamualaikum warahmatullahi wabarakatuh.